don't think that's a productive way to teach this, but I am going to walk you through some of these slides that give you the important ones. So there are some general characteristics. Venous circulation returns blood to the heart after exchange of gas, nutrients, and waste between. The vessels of the venous system originate from merging capillaries into venules, venules to small veins into large ones. Again, unlike the arterial pathway, those venous systems are difficult to follow. They have irregular networks, unnamed tributaries. There's a huge difference between individuals in the way that veins are. Should you be studying gross anatomy, you would spend a lot more time learning arteries than you would veins. All the systemic veins converge into the superior and inferior vena cava, returning to the heart through the right atrium. So if we look in the brain, head, and neck, important ones would include the external jugular vein and the internal jugular vein. Upper limbs and shoulders, we have some deep veins, which would include the brachial veins. Superficial would be the basilic and cephalic veins. In the abdominal walls, we have the brachiocephalic and asgios veins, which directly goes into the vena cava. Portal veins, we need to talk about portal veins for a second because they are unusual and we will see them in a couple of places. The liver is one, the brain is another. They don't transport blood directly to the heart. They go from capillary bed to venule and back to capillary beds. The abdominal viscera are drained through the hepatic portal system. So blood from the capillaries in the stomach and intestine and pancreas and spleen drain into the hepatic portal vein, which transports it to the liver for processing before it's delivered to the vena cava. So again, you go from a capillary bed to a vein back to a capillary bed. Portal systems, like the hepatic portal system, the renal portal system, filter blood through two sets of capillaries instead of one, and the second set of capillaries perform some unique function for the body. The lower limbs, the deep ones, are the external iliac. Superficial would include the small and great saphenous veins. Those are the longest veins in the body. Over the course of your lifetime, cholesterol can get deposited in the blood vessels. That would narrow coronary arteries. The heart might shrink slightly or enlarge, depending on disease state. Proportion of the heart constricting of cardiac muscle would decline. Increases in fibrous connective tissue in the heart, an increase in adipose tissue in the heart. Heart valves in the left ventricular wall might thicken. Increased systolic blood pressure, decreased resting heart rate. The lumen of the large arteries can get narrow as the arterial walls thicken, and there will be a decrease in arterial elasticity. None of these things are good changes, but they are changes that typically happen with age. By taking care of yourself, you can reduce the effects of these. Molecular causes of cardiovascular disease. Marfan syndrome is one. Familiar hypertrophic cardiomyopathy involves a defect in myosin. Inherited deficiency of mitochondrial enzymes that break down fatty acids. And familial hypercholesterolemia. Coronary artery disease is a disease involving the deposition of cholesterol plaques to the inner walls of coronary arteries. That can lead to obstruction of the coronary arteries and oxygen deficiency within cardiac muscle. It's often accompanied by high serum cholesterol and hypertension, cause pain in the chest upon exertion, called angina pectoris. And it is a contributing factor, a major contributing factor, to myocardial infarction. There are some surgeries that can be done, coronary bypass or percutaneous transluminal coronary angioplasty or angioplasty. Again, the best way to avoid this is see a physician regularly and maintain a healthy lifestyle. And that's where I'm going to quit. I'm not going into these two long explanations.